Let's get this show on the road. Welcome, everyone. My name is Paul Sims. I'm speaking to you from home in not quite so sunny London. It's fantastic to have you here. I've been looking forward to this webinar for really some time. It's called, as you can see on your screen, Insights, Rocket Fuel for Launch. Now, we often talk about insights. We often talk about launch. Why don't we talk about the two together as often as we might like? Well, that is the point that we're going to try and address today. It's been a popular session. More than 500 of you signed up. And as you will see in a second, I've got some fantastic people joining me for this session. But launch, it's so crucial. And these days, what's not just possible with insights is that you can gather them, of course, but you can also gather them increasingly in real time. And you can have technology play a role in surfacing the most important insights and bringing them to the top. So the idea that we would do something as important as a pharmaceutical launch without using the full range of what is available to us in technology, in process, in people terms, is, in my opinion, a little bit crazy. So we're going to get rid of the crazy today. And what I love to see, this is not supposed to be a natural segue from crazy to you, but what I love to see is that so many people are already introducing themselves in the chat window. Please do say hello, say where you're calling in from. A lot of you have the drop-down box set to hosts and panelists, which means I can see your introduction, no one else can. So a few of you, please reintroduce yourselves and put everyone as the thing. I think it may have defaulted to hosts and panelists today for some reason. So get that blue drop-down box on everyone. Let me introduce the speaker. Actually, before I introduce, I'm actually going to start my first little bit of interactivity here for you. I've got a question, which is called the state of today, and it should be appearing on your screen in just a second. And I want you guys to have a look at this. It's a three-part question. You'll see it's actually, each part is pretty much the same. How would you describe your company's maturity? And then how would you describe your organization's approach to collecting insights? And then finally, how well does your organization use those insights? So a three-part question. Please have a go at answering that while I introduce our wonderful panelists today. So Luca, you will know him as always the best dressed man in the room. I thought about trying to keep up with him today, but there's no point. He's always ahead. Luca was at J&J until recently, but he has recently joined BeyondTech. He's a great friend and someone who I think has a very ambitious vision for where we need to be in our industry. He's been doing some great work as a doctor before he entered pharma, and then obviously in medical across a number of countries. He was at AstraZeneca, Eisai, Novartis, then J&J, and most recently BeyondTech, and obviously has a very exciting pipeline with what we know from that company there. Smaller company, but one that is definitely punching above its weight, as we all know. Now, Mark Montgomery, I promise you that's one word normally, is the VP and International Head for Integrated Insights at Novartis. He is someone who we were very lucky to grace the stage at Pharmageddon last year. He's become a solid friend and someone who we always lights up the room wherever he is. He's got more than 20 years of experience driving brand growth in different Fortune 100 companies and, of course, at Novartis, transforming complex information into strategic insights. What better room could you be in, Mark, other than this one? So also bringing expertise in AI and data science, which is super key as well. April is someone who I've got to know only recently, and I'm very glad for it, not because she is instantly recognizable as a wonderful person and personality, but also because she has a relatively unique role. She is the US Head of Market Development. And as you can imagine, that is heavily tied to launch. It's also heavily tied to making sure that when that launch happens, it goes really strongly. And she's already shown herself to be a leader. She's driving marketing strategies, educational initiatives, and passionate about team building in her company as well. Really pleased you could join us, April. You're doing some great work. Andreas, another person who you might recognize from a webinar past, because he's so damn good. That's why we invite him back. He's the Director for Medical Excellence Operations and recently moved to Daiichi Sankyo. Of course, you may have recognized him in his previous engagements across medical affairs. Also, no slouch when it comes to understanding data science and AI, and that's one of the reasons why we were so keen to have Andreas here. Lance, I want to say not only thank you to him for being on this webinar, but also to his team who have been partners in getting today's session up and running. Fantastic people to work with if you're not already. Within3 is a trailblazer and has really evolved not only its own offering, but our industry's capability when it comes to turning insights from mere facts into something that is absolutely actionable and surfaceable and absolutely at the forefront of how technology is bringing this to bear. So Lance, couldn't be happier that you have joined us as well. So I can see a lot of people have been introducing themselves. If you haven't done that yet, now is the time. And I've got, only 60% of you have answered this survey so far. So come on, everyone. I'm going to close that in a minute, and I want to see your answers. Before I do that, though, you may remember you actually answered a question when you joined this webinar, when you signed up for it. Let's have a look at what the answers to that were. What are the biggest challenges you have with launch excellence today? It's a pretty fundamental question. Well, this is what the graph looks like. Let's see what the numbers mean. So 38%, the winning one is insufficient insights and data. Well, you are in the right place. That's all I can say. In second place was this one, and this is shortened launch timeline. So we're all operating under a little bit more pressure, shall we say, in time-wise going forward. Third place was less differentiation between therapies. Interesting. I didn't expect that one to do quite so well. Poor market intelligence coming in fourth place. And finally, territory setup and alignment. Very interesting. Okay. I also asked one more question. What is the most critical gap in your market intelligence? So what did people say? Well, a third of people said tracking regional variability in clinical impact, prescribing behavior, and access barriers. Interesting. Not what I would have expected to come first. So that's exactly a third of people. Second place was other. Interesting to know what the other is. Third place, detecting segments based on sentiment, opinion, or behavior. Fourth place, identifying unmet clinical and patient needs, which I expected to be higher, if I'm honest. And fifth place, tracking shifts in competitive positioning. Okay, so that's interesting. Right, so how are we getting on with that poll, everybody? I want to see, okay, we've got a few more people. So let's have a look at the results of that. Thank you, everyone that's answered. And as I pull up these results, I'm going to get rid of my slides and ask my beautiful panel to show their beauty and turn on their cameras, if that's okay. I will get rid of slides in the meantime. Let's have a look at the results of that poll. Ooh, interesting. Quite a clear result. So if it hasn't appeared on your screen, it will do in just 1 second. There we go. 51% of people saying intermediate. Got a bit of a normal distribution for that first question. Probably no big surprise. Again, a bit of a normal distribution for the second question. I can see 50% of people choosing intermediate when it comes to collecting. And, slightly better using. So 42% of people saying intermediate. And there you go. You can see the results for yourself. We could do better. We could do better. That is clearly the answer. I haven't obviously done this tally, but I imagine that the same people that write intermediate for one question are also writing intermediate for the others as well. Okay, guys, we've got work to do. That is very clear. That is very clear. I would love to hear your insights now. Let's start this conversation. And let's start with where we are today. That was the point of this poll. And why such a logical thing for us to maximize the use of insights at launch isn't happening. Can you maybe express not necessarily, putting down your own companies. And by the way, disclaimer, everyone's speaking today from their own perspective and not that of their companies. But why is it that is a struggle? Who wants to go first?
I can kick it off, Paul. I think one of the challenges we have is we live in such a data-rich time. And now with artificial intelligence and the ability to really capture just about anything that you're looking for in a short moment's notice, we're data rich. But I don't know if we're necessarily taking the time to understand the data or the trends with the data. And that really bleeds into where you're seeing some silos, right? You've got medical researching and looking into their own insights, often, as even the survey shared, not shared with the commercial team, and then the commercial team starting from scratch, which I think you even mentioned. In a very data-rich environment. So I think that's one of the challenges that folks are really faced with.
Interesting, but again, why not? Like, why would a commercial department not rely on medical? Like, what is there some kind of sclerosis? Is there some kind of cultural divide? I mean, we know there's a cultural divide between medical and commercial, but surely this should be more fluent. No?
I would agree. It seems common sense. Certainly does seem common sense. And I think there's perhaps some perceived firewalls that limits that interaction, but there's not the conversation that's taking place to best understand what are the limitations of those interactions to, drive forward a path of sharing those insights and really, taking a joint approach to how that data is going to be used.
Okay, I'd like to get some more perspectives. Who else?
I think
Maybe give it. Oh, sorry.
I was going to say, I was thinking what April said, those silos also then go down into the infrastructure. So oftentimes commercial medical have different budgets, which sometimes means different systems, different data repositories, different rules. And so even if you are trying to bring things together, you can be sometimes limited by what your investments have been over the past years. And that can be another barrier.
So it is self-inflicted, but it's also very hard to undo from what you're saying, Lance. Andres.
I just want to give it maybe a little bit of a positive spin, right? Because all those challenges do exist. But at the same time, I believe we have come a long way also over the last years already, to be honest. I mean, you see intermediate on all the different levels. And I think if you would have done the same survey a few years back, you probably would have gotten different results, right? So again, I believe a lot of those barriers still exist, but we are making progress, right? In addition to what April said, I would also say very often there's a certain over-reliance on our pre-launch assumptions, right? So we do a lot of investment into market research and all kind of data analysis, and then we develop very fancy and rigid plans around that. And then this is, feels like our baby. And then to let things go and then really trust in data and say, okay, we have worked with certain assumptions, but our insights have told us to go in a different direction is very difficult. So also the change and the mindset that needs to come with that is quite important. And that is, I believe, applicable across commercial and medical.
This is interesting, Andres. I've got a friend called Mike Rare. I think some people may know him. He runs a company called Idea Pharma, and he typically works on drugs around phase 2. And what he has done is he's studied how the more, even in phase 1, which we all know is safety, the more a drug is exposed to different environments in phase 1, the more the more we understand and the more we realize that our original assumptions may have been wrong. And he often says the TPP is killing innovation. So even at phase 1 and 2, we're locking in to what you've just said, Andreas. And that is, every time I say it, everyone nods their heads. I can see some nodding right now, but somehow this is still an issue. So just quickly, Andreas, do you think this is a more cultural, like not invented here type syndrome, or do you think it's more an organizational issue, or is it 50-50?
To some extent, it's both, right? But it's just a human nature, I would say. It's just, again, you have worked on, I mean, think about it. You've worked on a plan over the last months and years. And then the plan is started to be executed. And 3 months in, you realize all your assumptions are wrong, right? So I mean, there's a good reason why we have certain biases here, right? And why confirmation bias is an important one. So I'm just saying, so that is a human being. I think you can put in some structured and processes to kind of overcome that, to really have review cycles in, to really have regular touch point in, to have an open culture and an open mindset in the organization where failure is good, where failure is positive, and celebrate that. But again, I believe we're not there yet, not everywhere.
Well, it's funny because I always say medical affairs strives for perfection, but maybe that perfection goes too deep rooted in this case. We're unwilling to accept failure or deviation from the original plan when the rubber hits the road. Mark, I think you unmuted yourself. We'd love to get your insight here.
Yeah, I very much see this happening in pockets of excellence across the industry as a whole, Paul. I think as the industry starts looking at how to launch more drugs and rarer disease faster, these firewalls come down. And you see the collaboration, especially around phase 2, phase 2B, as you start looking at what market shaping is requirement. Leaning into medical is just absolutely amazing. And where Insights is going, it's becoming much more of a team sport than a deliverable. So the more you can get around the table, the better you are preparing that phase 3 TPP to go in and get the indications and the labels you're looking for, but also sets you up for what needs to be true in the market from a strategic imperative point of view. So even though the industry has a long way to go to break down those silos and break away from the habits of paralysis by analysis, there is light going on, and you're seeing pockets of excellence with drugs coming to market where medical is closely tied to commercial and pulling it through to the patient level. So I think we're heading in the right direction.
I always say that if medical and commercial are inevitably convergent rather than divergent, whenever I ask that question, everyone says it's convergent. Why can't we just speed up that convergence? I realize they come from different walks of life, different cultures, but if it's inevitable, can we improve it? And what you just said there, Mark, seems to suggest that we can do better. Now, a few of you are still writing to hosts and panelists, which is lovely. I'm getting to see everything, but no one else is. So make sure you set that to everyone, and please write again if you did do that. Luca, I really want to hear from you too. Oh.
Say something controversial. Can you hear me?
Yes, we lost you for a second and you sound a bit robotic, but keep going. It's getting better somehow.
All right. I hope it's good now.
We can hear you just about.
What's that?
We can hear you just about.
Oh, okay. Yeah, perfect. So my take is a little different. And I'll be honest. I think one of the reasons why we've been struggling with these sites for launch and medical affairs is that, quite frankly, I think we are not very good at e-sites in medical affairs. When you look at results or output of a commercial market research, it's very visual, it's very user friendly. It tells a story, and it tells a easy to digest story, right? I think the format matters a lot, and it's so much easier to just process and take action based on a few slides that tell a very easy story. And that's what market research, commercial market researches are all about. Now, the caveat is often when you then look into the details of the market research, you may realize that you have fancy, colorful slides, but sometimes those are based on inputs from 10, 15 doctors, right? So if you look at the source data, it's not always the case, but often, right, you realize that maybe the quality is not there. You have fancy slides and fancy actionable outputs, but not necessarily the quality that on the other side, on our side, I think on the medical affairs side, we probably have the exact opposite situation, right? We have tons of insights coming from literally hundreds of HCPs and KOLs. The format and the way we process those insights, the way we come to the next best action, that's where we are struggling. So we are not very good at telling our story. We're not very good at telling the organization what we need to do to be successful in our launch. And I think that's part of the problem. That's part of the reason why we have been struggling for many years. And I'll pause here. I think there is a bright side, but I'll keep it for later.
Thank you, Luca. Well, I do think you're the first person I've ever met from medical leadership who said that the commercial insights are better. But it's so interesting that you say they're better because of the fact that they are more story-like and they are presented better, which of course has historically not been medical's domain. Really interesting that you make that observation because of course that's the way we need to go as well. Lance. Save us, please, is my question for you. Can you help in terms of technology and how we can bridge this gap? You can see the direction we all want to go in. It's inevitable, yet we seem to be our own worst enemy in some cases.
Yeah, I mean, I think that the great thing about this topic right now is the advent, especially of evolving AI technology, can really help address a lot of the issues that we just talked about. I'll start off just with the data silos, right? So you have medical collects data, commercial collects data, data is available in the public domain. And in the past, we had to work very hard to try to bring all that together, very duplicative in creating those data sets, trying to do all that analysis. Um, you know, our company and others are trying to really solve that problem by using AI to do all of that analysis in a very integrated fashion. That saves that time, that work. Also with Gen AI, being able to inspect that data in human language. So instead of having fleets of analysts writing queries or fleets of consultants turning through PowerPoint slides, the ability to ask it a question such as, help me with my territory map in the following way. Those are things that the technology promises in the future. And so organizations are really working to bring that together in a way that wasn't possible before. Even Luca, what you were just talking about in terms of how do you take that data and convert that to presentations that are more executive worthy, more storytelling and easier to understand. Um, there's tools for that as well, to say, take these things and instead deliver it in a presentation with these characteristics. Those things exist in kind of more modern insight platforms. Because I do think the user experience of looking through the information as well as then presenting information is often overlooked. And that does lead to the kind of the issues that you're talking about, Luca. And I think when we work with clients, a lot of times, I want to come back to the word insight for a second. A lot of times what we see is a little bit of a blurring. So oftentimes on the commercial side, I see people focus on like customer level insights. So I'm going to meet with, Dr. April. I need to know everything I need to know about Dr. April before I go there. I'm got my omni-channel experience, understand what type of message Dr. April needs and when she needs it and what format and what the next best message should be. That's like a customer level of insight, which is critically important, where I think a lot of investment has gone in. Above that is like market level insights, which is help me understand if April's a tree, Dr. April's a tree, help me understand the forest, help me understand the trends. How do I move, change clinical thinking for larger sets of the population, understand unmet needs across larger sets of the population, understand market access issues across different regions and territories. That's kind of a different class of insights and insights issues. Sitting underneath all of that is all the same data, though. It's all about our customers, what they're doing, where they're doing it, how they're connected to each other. And so I think what I'm excited about personally and how I think the industry is going to move forward is I think for once, usually the technology is like in the way. The technology doesn't do what we want, can't do what we want, so we have to kind of work and build around it. I hope that we're at a point where maybe the technology can be helpful in breaking down some of those barriers that were discussed, because the technology doesn't care if this data set came from medical or commercial, doesn't necessarily care what the org chart looks like inside our own four walls. And that can maybe be helpful for us to make progress to address some of the other issues, the organizational and change management issues.
Lance, I think that is a great start. I'd be really interested to hear from the panel whether they are working in the same direction that Lance describes, whether they're investing in insights management programs, whether they see technology and AI as an answer, not the answer, but an answer to all of this. Give us a flavor for what's going on in your companies, if that's possible. And by the way, some of you will have noticed I've put a new poll question up about barriers, which is just a way to close off the previous conversation about challenges, barriers, and frustrations. So do answer that. I can see 30% of you already have. But back to the panel. Is it moving in your companies?
I would say not
Paul.
speaking. Oh, sorry.
Oh,
Go ahead.
like buses, nothing, and then you all come at once.
I would say not speaking about individual companies, right? But in general, there's a lot of investment in this area at the moment. I think it's very much top of mind of everybody. I think many companies try to really solve the data issue, because as you know, as Lance just said, of course, AI can help us to solve many of that, but at the end, it's still trash in, trash out, right? So you still need to have a certain source of truth when it comes to when it comes to insights. As long as they are sitting in all types of files and on local hard drives and you name it, it's still very difficult to make sense of all of that, all of that, right? So, but to answer your question, Paul, yes, I believe the entire industry is investing into that and to enrich the insight, landscape, I would say.
Yeah, and we often hear, obviously, garbage in, garbage out, and your data needs to be better. But at the same time, I feel like we've been saying that for a long time. And surely we've got to some data hygiene level that allows us, maybe in specific zones, to be able to do this better by now. No? Anyway, panel, please do share where you think you are on this journey.
So I'll jump in here, Paul. I think you're seeing an emerging trend in evolution of what insights is within organizations. And for us and myself, it really focuses on two things. How do you drive strategic decisions in the organization? And then how do you activate a market, either through the customer or medical lenses that we have in the field? In order to do that more effectively, the organization discipline needs to move away from how do you just deliver up some shiny decks and data points and get into what is the business questions we're trying to solve, the real problems behind the problems that we need to. And then looking at an organization, particularly as you start moving through the launch phases, what are the jobs to be done? And building upon your book of knowledge as you go at it. It really takes us to a point where you have to have an information strategy beyond just one primary market research, one data silo. It's how do we pull this all together that we're looking at the patient, the customer, and the market as one, using tools and focusing on the business questions to be answered. So I see information management being the biggest focus for a lot of insight professionals. And that's really where the value is going to get to from combining all the resources of an organization.
Okay. April, Luca, I really want to hear you on this one too.
Yeah, no, I agree. I agree with both Andreas and Mark. And I think, the sharing of information, right? So it's not just the insight management and information management but then it moves into how is that shared to help with the planning and the execution. And I think it's beyond just commercial and medical, right? There's a lot that we can learn from our market access folks, our patient advocacy groups, and the work that they're doing, but how are we combining the information and the insights that are being captured either at a forest level, the 70,000-foot view per se, even down to, a smaller geography level to really get a better understanding of what market is ready, to be ignited.
Okay.
So, and I switched to my headphones. Hopefully it's better
Yeah,
now.
I can hear you perfectly now.
Oh,
Carry on.
glad to hear. Good. So I think there are a few things that we need to solve for. Number one, we need to make our insights a bit more quantitative. And the one of the issues we have been having for the longest time is, oh, I heard from Dr. So-and-so that the safety of my drug is all wrong, and I'm really concerned. I'm not using your treatment because of the safety. And then you don't really know, is it really just that particular doctor? Is it 20 doctors? Is it like the vast majority? So we need to capture insights in a way that is a bit more than just, I heard this from Dr. X. I need to know how many people are thinking the same way, for how many people this is an issue. This is number one. Number two is about scale, right? If you think of being in a very small biotech where you have 5 MSLs, everyone is one text message or phone call away from leadership. So it's very easy to process insights. It's very easy to understand what's going on with your pre-launch or launch activities. When you scale up and you have 200, 300 MSLs, that's when you need something, right? AI probably is one of the solutions to help you with the scale, with the magnitude of insights, to also filter some of the background noise. And then last thing, and so I have three, the last one to me is still going back to the basics, which is less is more. Don't give me quantity of insights. That's not what I need. I really need those really actionable things that are going to inform our strategy, are going to make the organization, help the organization to change something into into our strategy as opposed to just a nice to have. So number one is quantitative. Number two is managing scale. And number three is going back to the basics.
Thank you, Luca. But I agree, quality over quantity. I get that. But in this day of computers being able to absorb such vast quantities of information and find those golden nuggets, is that still the case that we can't be feeding more to the computer and having them surface what's important? And I obviously want to hear Lance's opinion on this.
Look, you want to go first, but I think that's the goal, right? That is the direction that the industry is headed. And what I often find really interesting is just what is the kind of pace of technology? How fast is the technology evolving? So if I look at them, we're on a laptop using a Zoom, we're still having issues. I have them all the time, Luca, of like the sound's not working and these basic things don't work. The technology doesn't move very much. With these sorts of issues, with data integration and AI, if you think about where we were 3 years ago versus where it is today, it's vastly different. Where will it be 3 years from now? And so I think that a lot of the larger organizations are spending a lot of time and energy investing, as Andreas was saying, in trying to solve these sorts of issues at varying degrees of kind of pace, but also even for small organizations, mid-size and small biotechs, the ability for the technology industry, the private industry sector, which is also investing really heavily in these, to allow you to bring these things together quite quickly without those big investments, also exists for the first time. I think it's up to the leaders, in the industry to continuously try to figure out where can the computers help, where are the humans needed, and where's that intersection point? Because it's not going to stay static. It's going to move over time as we all gain experience, as the algorithms get better. But I think to me, it's unfathomable that you can't imagine a world, whether you think it's here now or you think it's going to shortly be coming, where you won't be inspecting large amounts of data and asking questions about activating market as an example, and closer to real time versus this sort of siloed different departments doing data on their own, doing insights on their own, rolling that up in some sort of manual fashion, and then translating that into PowerPoint manually, and then trying to create some sort of action or activity out of that. That doesn't seem to be a scalable way that the market's going to move going forward.
Thank you, Lance. I appreciate your considered response. You'll see I've put the results of the barriers question on the screen. But Lance, if I could just stick with you for one more second, you do get to see uniquely in this panel across all the pharma companies, and within threes working with almost every large pharma company. What is your frustration of where pharma companies should be investing more, but they're not currently? In terms of, where should the technology investment be? We've heard obviously lots of stuff about how data, and you can see on the results of the polls, the second question, guess which one won? Data is collected, but it doesn't translate into actionable intelligence for launch. 35% of people saying that. But from your perspective, give us a bit more nuance. Where is your frustration? If you could ask pharma companies to spend more in one particular area, what would it be?
My opinion, and I'm sure this will not be universally agreed to, but my opinion is that the best way to make progress is to, for example, pick a launch, and focus on using more of a contained asset to work through these various issues that we're talking about, because as opposed to the alternative, which is let's start building something for the quote unquote enterprise and hope that all launches of the future will be able to use these same sets of tools, data. So there's always this push and pull in a large company. You want to do things across the enterprise because you want scale and efficiency, but at the same time, it also has to be effective. And when something is new and changing a lot, it can be very difficult to build for the enterprise when the thing you're building, the ground is still shifting under your feet because the technology is adapting. I also think there's so much knowledge from the panelists on this panel as to what matters that needs to go into thinking about how the systems can help. And sometimes when you just kind of go on a 3 or 5 year journey on building things large scale, you lose some of that. So where I've seen the most impactful implementations and the best collaboration between commercial and medical, as an example, is when the scope of what we're trying to solve is tied to an actual business problem and asset. I get frustrated when, we work with clients, for example, and they say, well, what you have is wonderful, Lance, but we're building something over the next 3 years that's going to make all of it obsolete. It can be difficult to understand what happens in the meantime. So that's my personal bias as a
No,
technologist.
that's
I
good.
understand where that
Because
is.
some of us might have expected you to say the opposite, actually. April, you work in T1D, type 1 diabetes, and you have, as I said at the beginning, quite a unique title where you're able to really focus on market development. Obviously, you're going to probably agree with what Lance said, but tell us a little bit more about your own conditions of your role and what you've learnt by being able to have that therapeutic area specific focus that might be useful to the rest of us who might be working in more horizontal areas.
Yeah, great question, Paul. And it's certainly a interesting space and one that's readily changing. So I wholeheartedly agree with Lance in the market landscape changing, and are you being flexible and adaptable enough, right, to move with that? My position, itself is really focused on the collaboration between commercial and medical. It's focused pre-launch, it's focused post-launch. How are we really driving that peer-to-peer education? And that's where I find that close partnership between those two teams, but beyond that, to stretch out to market access, patient advocacy, even beyond, right, is absolutely crucial. And that's where the insights coming together, whether it be from any one of those groups, helping to inform brand strategy on, hey, pump the brakes. We know we were going in this direction, but what we're hearing, right, from the insights, whether it be from our key opinion leaders, what we're hearing just across certain markets, might make us want to change strategy or at least adjust. So it's an interesting role that I'm informing brand strategy. I'm participating in that. I find like I'm a compliant peas and carrots with our medical colleagues. I do attend most of their meetings, which really helps to give a little bit of insight into the strategy as we move forward from a brand perspective. T1D, as I mentioned, is a changing landscape. I think we're finding more and more of that in pharma, as most organizations are really focused on unmet patient needs. And so that need to have real-time insights and bent knees, so to speak, as the market shifts, as things are brought to launch and meet some of those patient unmet needs changes, the market's going to change. So I think, what Lance was mentioning on being able to pull that in real time and shift and adjust strategy is going to be really crucial for any organization moving forward.
Thank you, April. How much freedom do you have? Do you feel that you're able to invest in the technology, the tools, the processes that you need to uniquely, or are you at the beck and call of an enterprise-wide IT department?
Great question. Sanofi, I think, is generally focused, right, on advancing, as most organizations are. So I think with any good business plan and reason, I think anything is reasonable to be looked at, right?
That sounds like they're trying to keep a few people happy and not give the not give the controversial answer there, April. Well, I shall save you from any future politics. Mark, Andres, Luca, tell us if you agree with what Lance said. Should we be doing this therapy by therapy? Should we be finding lighthouse projects? Should we be marching on to show best case examples?
Yeah, Paul, I'll jump in here real quick. I love what Lance was saying. It's a strategy we've applied a couple times in the world of insights and AI deployment. Start small, but think big. Like, where are you going to get your win? When you look at what it takes to launch a drug, medical, access, and commercial all have to be a line of one. So how do you start with one brand and change that mindset and look at the patient journey more holistically? Start sooner with the market shaping. Really understand what needs to be true in your strategic imperatives there. But one of the big risks that we've noticed when you look at applying AI within an organization is this not the data silos. Roles change. Who's going to build the deck? These are very simple questions, but who's going to build a deck that leadership is going to sign off on? Are you going to have a consultant do it? Are you going to do it in-house? Who's actually going to use the tool? Well, what does the role look like if brand managers in that tool building the insight deck. So you have to rethink not just the data and information silos, but actual roles will change as we look at AI even more.
Interesting. Andreas, I think that's another dimension that Mark has just introduced. I want to hear your perspective.
Yeah, I think Mark touched on the people side of things. I think it's really important, right? So I do agree with Len's comment earlier around development of technology, and that is so fast in the times that we're in. I still remember the early days of AI when when we had this first iteration of an insight engine, and we always said the same thing as someone pointed out here, saying, okay, let's put everything in and we get something out that this machine will solve all our problems. But it did not, right? So technology was not there yet 3, 4, or 5 years ago, right? And then we always went back to the traditional way of doing things. And now it's like, because technology really picked up and technology is advancing so fast, now it's much more almost on the people side. But we say, like, okay, how can we make sure that everybody is on board? How can we make sure that people actually trust the technology and what is coming out there? Because people, in my experience, still tend to go back to the original whatever entries of insights and all that, to flip through them individually because they do not trust what's coming out there as an aggregated summary or whatever it is, right? So that is, I think, the people side and the involvement on their end, on this end, is something that we need to focus on, because technology is evolving so fast. It's very hard to keep up with that pace, to be honest.
Okay. Time is marching on, guys. It's 43 minutes past, so only 17 minutes left, and still only 30% of people have answered the question that I've put on the screen. So wake up, everyone. We've got work to do. 17 minutes left. I want to hear your answer to the question. I want to hear Luca's response to the previous question, and I want to get through a couple more interesting questions before we're finished here today as well. Luca.
Yeah. So again, I'll try to maybe give a different angle to the discussion in terms of where pharma or medical affairs should be investing right now. And in particular, given that I understand there is quite a bit of interest in the space of artificial intelligence and generative AI. The way I think about it is, if I were to invest money in generative AI or artificial intelligence in pharma, or again, more specifically in medical affairs, what I would probably try to double down on is investing on the future of healthcare. The reality is, in a not so distant future, I really think artificial intelligence will be more and more augmenting clinical decision making. Doctors will be relying more and more to artificial intelligence, whether through the EMR system or other platforms, to augment clinical decision making. The reality is, no matter what specialty you're looking at, I'm in oncology, but I think it's probably the same in other TAs. There is so much data, new data, that nobody can honestly keep up with any of that. Artificial intelligence is there to help. Now, why do I think this is a critical element for medical affairs? Well, because most of what we do today is to train, educate, partner with people, right? So we go to a doctor's office and we share our data, we educate people. In the not so distant future, actually it's already happening, we're going to have to train large language models that are feeding information to physicians to help them to make clinical decisions. So artificial intelligence is actually going to be one more stakeholder that we're going to have to work with, beyond the HCPs, payers, patient advocacy groups, and so on and so forth. So bottom line, if I really have to pick one area where I would honestly massively invest, is how do we get better as pharma at training, informing artificial intelligence, so that physicians, the moment they go on whatever ChatGPT and they say, okay, what is the new standard of care for treating colorectal cancer, my medicine is going to be in the answer. Again, I'm oversimplifying, but that to me is a big area.
You're oversimplifying. I don't think so. I think you're expanding the scope of what we're talking about, and that's actually a good thing. I think that if I'm being very brutally honest, that a lot of our discussion and efforts today, they're a little bit too incremental. And I think that we need to effectively create a new discipline, perhaps something like, launch intelligence is a phrase that Lance and I were using in a previous conversation. But it needs to become something that is maybe a bit more discreet and investable as a result, in the same way that many things are. Any reaction to trying to make this a bit stronger? And I'm going to do another poll now, which is called Making It Happen, which hopefully aligns with this very discussion. And I'm very happy with awkward silences. So
No, Paul, I'm going to jump in here. I think it happens, and I'm reading through the webinar chat panel as well. And many of those that are on the line are commenting on the same thing, which it really needs to happen pre-launch. And the insight sharing and how insights are going to be gathered and with what frequency are they going to be looked at, and what are the parameters to which that they are going to allow strategy to be altered or adjusted, really need to be set up prior to, we're 6 months out, we're about to come to market. So, and certainly in many organizations, we're no longer working in a US only or a France only market. We're working in a very global space. So I think those conversations need to happen, not just, for me in the US market, but across those other global markets and in partnership. Because that's really going to help to drive that brand identity, ensure, collaboration and consistency, but folks are moving in the same direction with the same commitment.
Mm-hmm.
Yeah,
okay,
Paul, I think, expanding on, I think what April just said and what you and I were batting around earlier, imagine a future world where there is someone whose title is, I'm in charge of launch intelligence for asset ABC, and I take up that role T-36 or whatever, long enough out where I can actually make a difference. What would change? And that purview crossed. It didn't care or respect medical and commercial boundaries in a rigid way. It literally just focused on, my job is to create as much in real-time intelligence as possible to further this launch through its life cycle. It would be really curious to imagine that sort of role as a standard operating procedure in companies. I don't see that sort of person very frequently at all, as an asset traverses through the life cycle.
Well, audience listening in, please answer Lance's gauntlet throwing suggestion that this is something that could happen, and tell me if it's a good idea. Tell me if it's unrealistic. Tell me if you feel that is the evolution we need to go through. And in particular, and you can see it's part of the poll question, whether that sort of agnostic, not medical, not commercial positioning of such a position or such an initiative is the right thing to do. Yeah. Mark, Andres, want to hear from you.
I mean, I know we're all very eager to move faster, right? So, Paul, I mean, we all always we talk about those topics for many years now. I think what becomes now the difference is that our environment is actually forcing us to move in this direction, kind of, right? So it's not so much about you volunteer to move in this direction or doesn't give you an advantage, but all the developments that we see out there, be it on the tech side, be it on the change in the market situation, a different expectation from our customers to be more customer-centric, from patients. So being, in combination with our products getting more and more complex, I think all of that moves us in this direction. Do we want to be faster? Yes, we want. But it's, we sometimes it also hits the reality of an organizational setup, I would say.
Mm-hmm. Mark?
Yeah, Paul, I think it's an interesting question. And as insight professionals, I believe we have the responsibility to go there on our own and not wait for permission. When you look at launching something, you need to be involved at phase 2. You absolutely need to understand, what's going to change in the treatment algorithm. That's a medical discussion. And so often we go outside and do market research, to 20 to 200 doctors, depending on the markets and size of the assets you're responsible for. But we forget that on the other side of the hall, we have doctors in every discipline that work in our organization. So how do you roll up your sleeves as an insight professional and work closer with the teams around you? It's the first challenge I would have to the group as we look at launches. The second one is you go into market shaping. Also look at it broadly. Don't ask for permission to go, I'm only doing HCP commercial. I'm looking at broadly what needs to be done from a patient advocacy group to a medical to really set up this product for success and find the patients that need to get to. And that's on us as insight professionals to pause and challenge even our own organizations and our own roles to look broader and use as much information as possible we can get our hands on to shape the go-to-market strategy.
A quick question that you may be able to see in the questions box, which I think is worth raising. Regarding the kits and kicks the MSL teams are provided, should these... Oh, that's not the question I was looking for. The question I was looking for is a different one from Pamela. In the age of AI and quantitative insight gathering, what is the right approach to ensuring the intimate and qualitative insights? I think that when we talk about technology and AI, our brains naturally think this means a big long row of ones and zeros. And obviously we've seen from our own conversations with LLMs that it's very much more than that today. So I just want to make sure that the qualitative as well as quantitative is being prioritized. And the question specifically says, is it chicken or egg? What's the right balance? Anyone?
I think it depends on certain questions. Help me understand what my staffing model should be is one question, which might be different than help me uncover an unmet need. And the degree that you use qualitative or quantitative information to answer those questions varies by the question you're asking. And then secondly, I think, what's certainly changed with generative AI, large language models that you're mentioning, Paul, is the ability to handle qualitative information and summarize qualitative information a lot easier than where it was 2, 3, 4 years ago. That helps kind of bring that piece together. And so I think, almost any question I can think of that's an insight question will generally require both, unless there's just a low level like population behavior analysis historically, like sort of question, like there's something like that, but it will always require both. And I think being able to bridge those two things together in a seamless way that comes back to the reason I even asked this question is because, or I asked for this information is because I'm trying to make a difference in my strategy. Bringing that to the fore is what's most important versus dabbling in kind of the bits and pieces of those items.
Thank you, Lon. I appreciate that. Look at the poll results if you can. So this one was called Making It Happen. How important is it to align medical and commercial insights? 70%, which is probably the highest number I've seen on any poll I've ever done, say essential. Maybe no surprise, but why isn't it happening then? And then number 2, if you could improve one aspect of insight and launch, it is exactly what we're focused on here, a system that continually gathers, analyzes, and recommends insights in real time. So not predictive analytics, not real-world evidence being brought in, not a clearer framework for launch decision making, not better training, insights, and leadership. So interesting, all of the things that we're not asking for, and clearly that real-time ability to pivot, to be agile, sorry to overuse the word agile, but to do that at launch is obviously critical. We've got just 3 or 4 minutes left, guys. I want you to all now imagine, I know Lance already is, but imagine you're all CEO for the day. Congratulations on your promotion. What is the one thing that you're going to do Monday morning to make sure that this insights process in a cost-effective way happens more readily and that the next launches are as fantastic as they should be? What is the one thing that you would like to really make sure that you are going to make happen while you're in this position? And I want to hear from each of the pharma panelists on this very quickly. You've only got 20 seconds each, so short and sharp. Andres, you look like you're about to talk. I'm gonna.
So
I
again,
want to go first on this question, right? But
I would just say again, insights is a team sport, right? So it's really the tech side is important, but I believe it's really about building a culture around agility, continuous learning, and strategic refinement, right? So this really cross-functional culture is the first thing I would address, to be honest, if I would be in such a position.
Okay, cross-functional. Okay, who's next?
I'll jump in, Paul. I agree with Andreas, and I think I would add, understanding the sources of information that each function or department is getting, right, their insights and information from, to try to streamline that. Not so that there's consistency, but so that there's one source of truth that we know there's confidence in.
Okay, confidence in a single source of truth. I like it very much. Mark and Luca, you're up next.
Yeah, so great question, Paul. If it's up to me completely, I'd find that one brand that's in a phase 2. I'd put the right team around with them and then empower them to break the model using AI and connected insights across medical, access, and commercial.
Okay, strong. Luca, you get the sucker punch.
To me, is less about integrating insights and more about integrating decision making. I don't care where the insights are coming from, medical, commercial, market research. It doesn't really matter to me as long as I have a strong engine of processing those insights and making a decision based on that. So less about the integration of the insights, more about the integration of the decision making, define the strategy.
And just quickly, Luca, as CEO, how do you what organizational or process change do you make to ensure that integrated decision making? Just help us visualize it a little better if you can.
Yeah, to me, it's about having an enterprise mindset and making decisions that are not for a medical action only or a marketing action only. It's about making a decision that is to drive medical adoption, which is what we need to do in pharma.
Okay, marvelous. So with just a few seconds left, Lance, you have the final word. Anything to add that you would wish for with your magic wand?
I think I agree with everything the panel said. I'm excited. It's rare that you see this much change happening this fast, and I think this is a space where companies are just improving leaps and bounds every year that goes by. So it's very exciting.
Well, thank you for finishing on such a positive note that change is indeed happening. We might be behind the curve, but we, as Andreas actually said earlier, we're a lot better than we were a few years ago, and we are going to get there. So I'm appreciating the positivity. We've just hit the hour, guys. I want to say a huge thank you to all of you who contributed to this discussion. Our panel has been really generous to offer their insights and energy into this conversation. Really appreciated. Lance, your team at Within3, excellent partners to work with. Thank you so much. I really want the audience, and obviously massive thank you to you too, especially those of you who've been active in the chat, active in the interaction. Please do suggest anything that you'd like to see from us in the future, particularly around this topic. I'm going to hold this window open for a couple of minutes, so you've got time to write your ideas in before you get to your next meeting. Hey, you can be 2 minutes late, come on. I obviously wish you all the best of good fortune with this. Please do look up what Within3 is doing in this area. They really are trailblazers in such a fundamentally important part of our industry. And obviously, I really look forward to seeing a few of you at the Pharmageddon events and in future conversations where we're going to talk about how to accelerate this even faster. Come on, everyone. All right. Thank you so much, guys. Good luck. And I will see you on the other side very soon, I'm sure. Bye then.